Good morning, good afternoon, good evening, and welcome to another episode of Something About Surgery. Today, I want us to talk about international patient safety goals. This is in line with the theme of quality, which is celebrated in the month of November. If you remember a previous episode, we spoke about quality in surgery, and we spoke about the 6 domains of quality in healthcare, and the first domain was safety. So what does safety mean? It means that patients should not experience harm when they are going through a healthcare service. When you look at one of the big international accreditation bodies in safety called Joint Commission International, they have come up with 6 international patient safety goals. And today I would just like to highlight them so that you are aware, so that when you're going through a surgical service, then you might be able to notice when something is amiss and remind your healthcare provider, because you also contribute to your safety. Remember patients' rights and patients' charter that we spoke about? Yes. So number 1 on the international patient safety goals is that we should identify patients correctly. When you're going through the hospital, you won't be referred to as that patient with pneumonia or that male in bed 6. You should be identified by a full name and a unique hospital patient number. And most of the places, you will have a bracelet here carrying those, because this is the only sure way for us to identify patients correctly and not to misidentify. If you remember a case that happened some times back, there were 2 patients, both of them named a non-African male. One of them needed surgery, the other did not. The one who did not need surgery ended up having surgery. We like to avoid such mishaps by making sure that patients have at least 2 identifiers, a full name and a unique hospital number. Number 2 is that the hospital and the healthcare providers must improve effective communication. What this means is, if you've gone to the lab and the person in the lab is calling your doctor to give you a result, then they call again, introduce themselves. Again, they use the full patient identity, which is the name and the number, and then they read the results to the doctor. Then the doctor is able to write that down and read back and say, so if I understand you said for patient XYZ number 1, 2, 3, their result is as 1, 2, 3. That is the only way the communication has been effective. 2-way closed loop communication. You might not go through this, but just understand that this is going on the background. Number 3 is that the hospital has to improve on the safety of high alert medication. Now, there are serious controlled medications in the hospital that a slight mistake could end up with the patient getting the wrong medication, and that wrong medication could cost a life. These are called high alert medications. Medications that can cause drowsiness, or what are called opioids, medications that can addict, medications that look alike and sound alike, because if there's a slight error in that, then we harm the patient. So you will realize, or you might not realize, but it always occurs that these medications have a way in which they are controlled. They're in a special place where they are kept. The person who has access to that key is not one person. Probably they have 2 keys, and different people have those keys, so that the first person opens, the second person opens, and they confirm. And the other thing is that the doctor writes those medications in full, so that there is no shorthand, there is no initiations, and the same communication that we've spoken about is read out clearly for this medication to be given. Something happening in the background that you might not be aware of, but something that you might see your nurses doing when they come to administer medication, because it is a high alert medication. Number 4 is to ensure safe surgery. To do this, very easy. We have a tool that was introduced more than a decade back called the WHO Surgical Safety Checklist. What does this do? It makes sure the team pauses and asks themselves questions. Is the patient the right patient? Have we marked where we are going to operate? Is the machine working? Are we anticipating a lot of blood loss? Are we anticipating any critical events in the process? So that the team is prepared, so that in case that happens, then they are set and they know what to do. When that tool was introduced, it drastically reduced complications, including death from surgery. If you're going through surgery and probably you're not fully asleep, then you will hear your surgical team ask asking to confirm that this is the right patient, that they have the arm tag, that their right surgical site is marked, etc., etc. Number 5 is to reduce the risk of healthcare-associated infections. Now, healthcare-associated infections is a leading cause of delayed hospital stay, delayed discharge, and huge hospital bills, be it pneumonia, be it pressure sores, be it infections of the surgical site, what we call surgical site infection, name it. And therefore, every day, hospitals are working around that. And one of the quick things you will observe is that the doctors will change gloves when they're examining you. They won't examine you and then move to the next patient and examine with the same gloves. You will see them sanitize their hands as they move from your bedside to the other, and as they leave your ward cubicle to go out, they will sanitize their hands, etc., etc. So all these are measures put in place to make sure we reduce drastically the risk of hospital-acquired infections. And finally, it is important that hospitals reduce the risk of patient harm resulting from falls. Now, falls in the hospital is a crazy phenomenon. Almost 1 million falls occur every year in the hospitals because the patients are sick, they feel dizzy, they get slippery, all those things. And therefore, again, as you walk through a service, especially if you have an injured leg, you are going to have surgery, you will find in most hospitals a tag on your arm, again indicating that you are high risk of fall. What that means is that anytime someone sees you walking alone unaided with that tag, they quickly come to your assistance. What happens is when anyone sees you with that name tag, they make sure that they have raised the side rails in the bed so that you don't roll off and fall. And as you walk across hospitals, when they are cleaning, you see some red triangles written, slippery floor, numerous kinds of things. But these are also put in place to ensure that patients do not fall in hospitals because of the burden of falls in the hospitals, because of how huge a problem falls are. Those are the 6 international patient safety goals, even as we talk about safety. That we have to identify patients correctly, we have to improve on effective communication in our settings, we have to improve on the safety of high alert medications, we have to ensure safe surgery, we have to reduce the risk of healthcare associated infections, and we have to reduce the risk of patient harm resulting from falls while in the hospital.